have you been there from morning, and can you give us an update as to what's happening with the schools in St. Catherine?
Well, I can't speak specifically to St. Catherine wide. I can speak to the southeast St. Catherine, and more so the Portmore area. I know that the principals have been they are quite concerned about what is happening in Portmore. In the Waterford area, we have confirmed reports that there are at least 2 deaths arising from the dengue outbreak. A 4-year-old just over the weekend. I think it was a 9-year-old prior to that. In that area, we have a primary school, infant school, about 5 basic schools, a high school, and in close proximity to that, we also have the Hart Construction College and the Portmore Community College. So in a concentrated area, really a number of persons and institutions that are really concerned about what is happening in the area. So, as a member of Parliament, I'm really calling, as the spokesperson is, for a more detailed assessment of what is happening in the Portmore area. We also would like to see, for example, he spoke about the need to activate some of the health centers across Jamaica. I don't know. There's 2 in Portmore, and he has mentioned 1 in Greater Portmore. But in the area where the dengue is directly affecting persons, in the Waterford area, there is a clinic there that he has not mentioned. And I am calling for him to look at the Waterford Health Clinic as one of the clinics that can be utilized, the services. There needs to be the improved fogging of the mosquitoes. I'm in touch with the mayor. He too is speaking with the Ministry of Health to see if funds can be available. And of course, whatever methods to be used for vector control, I am asking that as a matter of urgency, those matters are put in place.
Okay. Once more, RJL. So, Fagan, have you had reports of the impact of dengue in Portmore in terms of number of persons affected so far and reported deaths and
Well, the truth is that people are nervous. They are not too sure how to, outside of what is being said in a kind of a PR way from the ministry, from the minister. Not a lot of work is being done on the ground to educate the people and to help them to understand what is it that they should do or should not do. I think that there's need for more work from the ministry to help the people in the community to understand the danger of the disease. But outside of that, the truth is that people are very concerned. They are not too sure how to handle themselves as far as this particular sickness is concerned.
Following up to your question, though, Prince, in St. Catherine, there's been 187 cases. And in December, they had 40% of that. And that is one of the things we had mentioned in the opening statement, is that despite the suggestion that what has been done is adequate, even now, you don't know and we don't know where are the areas in the country that dengue is most concentrated. If you ask yourself that question, where are the communities in the country that dengue is more concentrated, and what are the measures that has been put in place in those communities? Do you know that? We have not been told.
We have not been told that. And if I may follow up, the minister had mentioned, he actually mentioned some names, more like in the West, where he would be using staff members and increasing numbers of persons, especially using the Hope through the Hope program, to go into these communities. Nothing has been mentioned about an area like Southeast St. Catherine or Portmore, where it has been found to have some of the deaths coming out.
Okay, all right. The question there then.
Just have two questions. Stephen Summers from Nationwide News. Mr. Campbell, you mentioned some deaths at Bustamante Children's Hospital. I think you said 10. Could you give us?
He said 8.
8.
Maybe you have information of 10.
About, in terms of the timeline, what period are we talking about, as well as the other numbers you mentioned. I know you mentioned it too.
I think you want to pose that question to the minister. I am saying that he has mentioned that there are 7 deaths, right? And I'm saying to you that our sources, based on our information, there has been at least 8 at Bustamante Hospital for Children, and that we know of recorded deaths from other facilities during the course of the year, especially during the latter part, since November coming on. But the minister should provide us with that information. Remember that your colleagues carried a story on Christmas Day that 4 persons had died at Bustamante Hospital for Children from the dengue outbreak. And at that time, they were having the infectious disease ward overflowing. This is the information that the minister was aware of, because it is the ministry that put measures in place to house them elsewhere. We didn't do that. Some random individual didn't do that. The ministry saw that the infectious disease ward was overflowing and therefore put measures in place to house them elsewhere. The ministry is aware that at that time you had 2 persons in the intensive care unit who were bleeding into their brains. One was brain dead that has subsequently died. He is aware of this information.
Just one more question. The ministry, has maintained that it has been providing information. It started in November when it noticed that the numbers were very concerning. It did say that this is a concern, and even though it wasn't at the threshold, they say, for an outbreak, it did mention that it was a concern. They were seeing, I think, 250% increase in cases. Yet you say that they didn't act in time, or they didn't act as they should have to prevent the crisis. What do you say to persons who just say, the PNP is playing politics because the ministry did indeed come up with the information that was needed?
I'm happy you asked that question. I've noticed that speaking the truth is now being categorized as politicization. I was watching the local government debate, and I heard Councillor Allen from Spanish Town say, if you're from Portmore and you've been bitten by a mosquito, blame the PNP. That is politicization. I was also watching my television and saw the Prime Minister on a political platform saying that he can hear dead babies crying, that if you had voted for the Labour Party, they would still be alive. That is politicization. What we are saying is that there was a warning from CARPA in May 2018. This says the region should brace for an outbreak. By November, you had more cases than you had in all of 2017. You had 412. That is an increase of 130%. We made a warning then. The minister came out, they said, nothing to be concerned about. December 14th, December 14th, are you employed to the ministry?
No.
Okay. At that time, in November, and the minister came out and had a press conference in December that he reassured the country.
I don't recall the ministry saying that there was nothing to be concerned about, though.
You don't recall. That's fine. That's a popular.
I'm saying, did he say
No, that's a popular thing in Jamaica. I don't recall it's very popular in Jamaica. That's fine. No,
Did
no.
the ministry say that?
no. I am saying to you, I have made my statement. You have said you don't recall it. I leave it at that. I am finishing my response to the original question. That by the 14th of December, there was now 570 cases. That is an increase of 300%. When the minister says that he's waiting for it to reach 96 in a month, these are not statistics happening randomly. These are persons that have to be infected. So essentially, what was happening is that the Minister of Health was waiting for more Jamaicans to be infected prior to escalating the measures. What I am saying irrespective of whether or not you want to call it an outbreak, what we had was a crisis because we have 300% increase. We have a warning from an international body telling us that we must brace for an outbreak. He has information that his only children's hospital is overflowing at its borders and they have to make measures to put them elsewhere. He had information that persons had died from complications of dengue. And if you are satisfied that knowing all of that, he waited until you had 96 in 1 month to spend 250 to employ new temporary workers, then that's fine. No, no, my dear. Those were announced when he declared an outbreak. That is a statement of fact. That was not done prior. We called that this situation is a crisis and it should have been managed as such because persons were dying. We don't treat statistics. We treat patients. We're not going to sit saying there are 80 cases, but we must wait until 90 prior to implementing measures. I disagree with you on that one.
Okay, well.
Afternoon, Sanjay Lewis, 4106. Now, the ministry is on record, Dr. Campbell, from as early as November, stating that there is a spike in number of cases. And the minister was on our program, Morning Agenda, this morning, stated that the hotspots are Westmoreland and St. Catherine. So he identified those. My question to you is, understanding what had happened and you're saying that they didn't do enough, what are you therefore proposing that the ministry now do to control this?
Well, I've said some of it. One, this is not the first time that Jamaica has to contend with an illness that is transmitted by the Aedes aegypti mosquito. It is the third such illness carried by the same vector within the last 4 years. So we've been down this road before. Two, the country does not have the facilities to do the necessary testing. That is the reason why the confirmed cases lag behind. So when the ministry comes forward and reports, as was the case with Chick V, and notice we're not trying to make any excuses for it, we're putting it on the table as a point of reference. As was the case with Chick V, the minister was being told that you only have X amount of confirmed cases, but the population was suffering from the illness. It is the same thing that has happened with dengue. The ministry was saying only X amount of confirmed cases. However, what we were seeing on the ground is that you had several more cases. So the ministry needs to do proper testing. The ministry needs to tell us where are the hotspots. You have said, he has said 2 parishes. We need more concentrated information than that, right? He needs to come to the country and speak to them about the things that, and remember, you know, you would tell me this because you do communication. The communication is not only what is said, it's what is understood. And I'm saying to you, if you go out there and you ask the people if they have been communicated to fully about it, they will answer your question. All we are asking of is for a proper education program. And mind you, some of these measures have been implemented since he declared an outbreak, which is why we said it was reactive and not proactive. Because what he did at the time of the announcement of the outbreak proves to you and I that those measures could have been implemented before in an attempt to prevent an outbreak, seeing that you were already seized of the factors that I mentioned before.
You mentioned the Daniel Arjo Call 106 Morning Agenda. You've spoken about the lack of testing facilities.
Yes.
And Dr. Dawes has come out to say one of the reasons he doesn't report is because the reporting mechanism is tedious. This morning on the Morning Agenda, the minister did indicate his willingness to modify or to listen to any recommendations for modifying that reporting process. Is there any suggestions you have on that?
Well, there's a book that you report all of these illnesses, right? That you sign it up. I don't think that it is necessarily tedious. What I think is that we have not done enough to bolster our labs to do the testing for these viral illnesses. That's what I think is the issue. Now, I'm saying, having gone down the road with Chick V, there was some upgrade to the lab at UA, but we're still in the position that we're not doing the test. I know of one private institution that has reported 7 positive tests over the last 5 weeks.
Is the position then, Dr.
So I'm wondering if the ministry has been doing any of the tests or just the private institutions.
that we don't have, as you have put it, in place proper testing facilities, and one of the recommendations would be enhancing those testing facilities to ensure that we combat the vector problem?
That is definitely one of them. There needs to be as well the adequate budgetary support to try and eradicate this vector that has been responsible for 3 or 4 of these illnesses over the last 4 years. We cannot escape that point, you know. I am also saying, remember that you have dengue leading to dengue hemorrhagic fever, which can lead to dengue shock syndrome, right? Essentially, you can bleed, and then from bleeding, you lose volume, so you can go into shock, you can die. These persons bleed because their platelet count falls. Platelet causes the blood to clot. Have you heard of any drive anywhere, right, for increased blood donation so that these persons can have that blood product in case they need it? There was one youngster at St. Ansby Hospital whose platelet, the normal is 150 to 400. Hers was below 20. They needed platelet, and there was none available.
You have mentioned, appreciating that, you have also mentioned the fact that we need to do something to control this vector situation. Is there a role for the Ministry of Environment in diagnosing or crafting a policy going forward to ensure that we actually control this problem?
Yes, I would assume that there is some form of communication between the different ministries and ministers. In the former administration, we refer to it as joint up government, right? And joined up government. And I don't worship at that church, and therefore I could not tell you the beliefs of those members.
But if I may, in response to your question, currently, there's only one laboratory in Jamaica which is certified to give results on dengue, which is the National Public Health Laboratory. There are private institutions which give IgG and IgM levels, which are not certified by the ministry to do. So as private physicians, when we send to these private laboratories for these levels as an indicative suggestion that there is dengue, we get that, but it's only National Public Health Laboratory that can certify it or certify it. The challenge that we have is that that laboratory is unable to process the amounts that, the numbers that are coming in, as they are in other areas. Samples go to the laboratory, it takes a very long time to get back. So it makes no sense you send a sample and you wait a week later to get back the results. Complications will arise by then if you're not certain what you're dealing with. So,
and the figures taken from the private labs used to collate the figures overall for the national output of the disease?
I'm not aware of, I'm not certain, I can't speak to that.
If I may also add in to what Dr. Guy has said, on the general breadth of what Dr. Campbell is putting forward as a party's position, and Stevie's earlier question, I think that, you know, we have a very short memory, the 9-day wonder. We've done this with everything from Chick-V to Ebola preparation, Zika, and now dengue once again. We will have more cases. There will be more before there's less, because the nature of the disease is such that as you have more people who are infected, then clearly there are more people circulating. Mosquito population is going to still exist. We're not likely to eradicate the mosquito from the island. There are going to be people moving again after the holidays from Westmoreland to Kingston, Kingston to Portland, wherever all they have to go. School is open, and all it requires is that the mosquito bites an infected person. Remember that there is a period of incubation. So you may be bitten today, but not have symptoms for several days to come. And therefore, if you look at the website, the ministry's website, and you look at the epidemiological reports that are done weekly, you'll see that the trend that Dr. Campbell is referring to is not only for dengue, but for all febrile illnesses over several months. We've seen a steady increase. Now, this returns us to the central point that some of you who have been covering health for some time would realize our system is underfunded, our staffs are overworked, the burden of disease already is high. In other words, there are thousands of patients coming to Bustamante Hospital, St. Ansby health centers every year. So when you add a viral illness or a febrile illness like dengue fever, we're overburdening persons. The president of the NAJ has already indicated the concern of her membership. I'm sure that the Jamaica medical doctors and the consultant groups would also have similar concerns. We're not hearing about the funding of our healthcare system.
the IDB, several years ago, provided funding to the government. At the time, it was Minister Horace Daly who signed the agreement for a 10-year strategic plan for the healthcare system. We haven't seen it. If we don't know how we're growing, we cannot deal with vector-borne illnesses or any other illness. So we should have had the funding in place for these issues from the early part of the financial year, so that as there's a rise, we'd have more fogging, more vehicles, more persons on the ground, more staff allocations to follow the trend and not after the fact. The second point that I think Dr. Campbell has made very clear is the communication, the channels of communication. Certainly for me as a physician, I would expect to be engaged. All our contact information as private physicians is with the Medical Council of Jamaica, or associations like the Medical Association of Jamaica. It's easy to disseminate current information and trends. The second point is that as an opposition, the spokesperson and opposition in any area, but today on health, should be engaged at the highest level and briefed regularly on the issues and also possible solutions, because we can't just keep talking about bipartisan agreement and continuity of care, except when it matters. You're playing politics with people's lives if you don't plan for their futures. And so we can't look at electoral cycles, but start to engage both Dr. Tufton and Dr. Campbell at a shadow cabinet or cabinet level to share what's the reality, ask for buy-in, so that as both political parties, we can identify solutions that allow the country to feel safer. And as MP Fagan has raised the point, the uncertainty is not, we're not insisting on panic. We want just transparency, clarity, so that each individual Jamaican knows their situation, their risks, and how to manage. Government cannot be expected to manage all our lives. We can take responsibility, but that can only be done with clear and concise information on a timely basis.
Just to go back, yes, Madam, from Nationwide, carried in the Jamaica Star on the 14th of December. The Chief Medical Officer, Dr. Jacqueline Bastesa Mackenzie, was speaking. Based on the information we have now, we are having a more active season. However, it is not at outbreak level at this time, but we continue to monitor the levels of dengue, she said. She went on further to say there is no need for alarm. So what I said there's no need to. So that's exactly what she said. So if you're challenging it, at least I'm giving you the source now. I'm telling you the date. It was carried in the Jamaica Star, December 14th. So you can update your records. Thank you.
I just wanted you to speak more about the platelet count you've been talking about. Is it that special persons are at risk of this? I don't really understand it. And how can those persons protect themselves?
So this is why I'm a little bit more peeved about the management of this than I would be normally. Because chickpea would only cause mortality if you have some comorbid illness. So you'd have had to have some heart problem or something before. Dengue by itself can kill you, because dengue causes dengue hemorrhagic fever and dengue shock syndrome. So when you're infected with dengue, it causes your platelet count to fall. Yes? And as I said, the platelets are what is responsible for the blood clotting. That's why you don't just bleed out as an individual. That's why we encourage persons not to take the blood thinners, like aspirin, because it will make a bad situation worse. So for most of the cases, certainly the ones that I have seen, all of them that have tested positive, their platelet count has been below a third of what it should be.
That was before or after the dengue?
No. When they're tested, they're presenting, they're seen, the test is done, we ask for the platelet count, the complete blood count. So we look at the white cell count, we're looking at the platelet count, we're looking at the hemoglobin, right? And I'm saying when we look at that, the platelet count in all the cases I've seen has been less than a third. I made reference as well of a young lady that was at the St. Ansby Hospital whose platelet count had fallen to below 20. Yes? Now, I'm saying that I would think that a part of the response of the ministry would be to encourage persons to go out and do the blood transfusion so you can get that product out of it.
Donation.
Right? Do the blood donation so you can have the platelet to do the transfusions when needed. Because it is clear that dengue hemorrhagic fever will cause these individuals to bleed and they can die.
So that would save them then, the blood?
Essentially, it would.
Are there any other questions? Okay, then other questions, ladies and gentlemen, thank you for coming, and I hope you will use information gathered here to inform and educate the public. Thank you.
Use your mosquito repellent, wear your long sleeve, take care of your environment.
And read. And read.